Hello, my name is Maria Fernanda Lorenzo-Gomez. I am professor in the Department of Surgery at the University Hospital of Salamanca, located in Salamanca, Spain. On behalf of my co-authors, I am happy to present our work regarding the importance of the human papillomavirus in the urethral syndrome in women with the first ever ICS online meeting. The presenter does not have any conflict of interest to declare. The human papillomavirus is considered a sexually transmitted disease, but usually the exact origin cannot be determined. Different types of human papillomavirus cause different infections, such as the visible and less visible genital warts of the cervix, vagina, vulva, urethra, penis, and anus, causing pain and increasing the risk of developing cancer. The objective of this study was to determine the impact of the detection of human papillomavirus as an etiopathogen factor of female urethral syndrome. The study was a retrospective, multicentral study of 888 women who presented with recurrent urinary tract infections. In 41 women, urethral virus research were carried out. Patients were grouped according to the initial symptom of presentation. Recurrent urinary tract infection, isolated urethral pain, and other like urinary incontinence, microhematuria, perineal paresthesia, and difficult voiding. Variables studied were age, concomitant diseases, follow-up time, and relationship with coitus. Patients were younger in Group A and older in Groups D and E. 60% of patients in the whole sample did not have any comorbidity. 20% were a smoker and nearly 10% were studied as having overactive bladder syndrome. Median follow-up time was 2.5 years, with a range between 1 year and 50.5 years. There was a positive relationship with coitus in nearly one-half of the patients. However, no patients in groups B and D confirmed that the papillomavirus infection could have a sexual origin. There is a negative correlation between age and relationship with coitus. Fewer relationship with coitus was confirmed in elderly patients. Most of the scientific texts assure that the human papillomavirus infection is a sexual transmitted disease, considering it a health and social problem. On the other hand, the diagnosis is limited by the fact that the sample collection is invasive and because the state of the replication of the virus might be low, making its determination difficult. Therefore, it is important to show that the relationship with intercourse is not always evident. Diagnosing human papillomavirus in women with urethral syndrome can be determined for better management and compression of the symptoms. We conclude that viral urethritis due to human papillomavirus is a mandatory etiology to investigate in female urethral syndrome. The findings of the present study demonstrate that traditional sexually transmitted diseases concepts must be reviewed in this entity for proper urological management. Thank you for your attention.